Why treatments fail. I wish it was a perfect world where all treatments always worked. However, I will break down a little bit further why treatments may not result in the desired outcome. Particularly as people start to do their own research online, I think it is important for physicians and also people seeking treatment to understand how and when things work or fail. Diseases and conditions sometimes progress to the point where treatment is no longer helpful. A good example is where injections for knee arthritis initially helped, but eventually it was time to have a knee replacement. There are also times and conditions or things that are just the way that they are. The severity of the condition has progressed to the point where treatments do not improve their quality of life. This is sometimes very difficult to accept, and we start searching for reasons why things aren't working or for different treatments. And this is okay. Sometimes you do have to go the extra mile on your own or with a physician to find the treatment that works for you or to help accept what is actually happening. Not setting appropriate expectations, I believe, is actually a very big reason why treatments fail and or patients may be disappointed in the outcome. I think that physicians should do a better job of setting both short-term and long-term goals and be very clear. In addition, I think physicians should follow patients out much further than we actually do. Seeing someone less than 6 months after the treatment has been implemented can give you a false sense of success. I also think that people believe and hope that medications, injections, or even surgery is going to help them for forever. Sometimes this is true, but oftentimes in the musculoskeletal world, there's a bigger picture that also needs to be addressed to prevent recurrence or new problems from popping up. Lastly, there is miscommunication. When it comes to treatment, I have a fairly routine set of recommendations. However, every now and then, a patient will swear that I said something that I almost never said. In this situation, it is not necessarily helpful to point out the miscommunication or point fingers. I simply accept it and I try and find a new way to help them. What we believe as patients is very powerful. When a patient believes that something doesn't work, it often doesn't, particularly when it comes to conditions that can be treated non surgically versus surgically. From a patient standpoint, it can be difficult to see how non surgical treatment can be effective. I'm not saying believe everything a physician, friend, or Dr. Google says without skepticism. However, you have to acknowledge that your outlook does influence your outcome in a positive and negative way. Similarly, we can sometimes self sabotage ourselves in other ways. Sometimes we believe that things are just band aids, therefore, we do not think that it's going to work. Again, what you believe may actually be true. However, it is my job to help give you the necessary information and help you make an informed decision no matter what. Another comment patients will make is that their insurance is requiring me to do this treatment or that I'm just the middle person in the way of them getting surgery. This might actually be true. Insurance unfortunately does have a lot of control and say over what treatment options are available to patients in addition to when they can be implemented. That being said, coming in with this kind of mindset can be detrimental to your overall care. Not all conditions have a silver bullet solution. Naturally, this is what we all want, but it can be a source of frustration for patients and perceived as a treatment failure. When it comes to orthopedic and spine related issues, the treatment should be multifactorial. Sometimes we hit a home run with a simple injection or medication. However, there's often a bigger picture to address. Injections, medications, and even surgery to extend is a great to an extent is a great short-term solution. However, to truly improve your overall quality of life, a multifactorial approach is often the best path. The power of suggestion is also a significant factor when it comes to treatment outcomes. We often lean on our friends, families, and neighbors when it comes to our medical issues. However, it's pretty common for me to see a patient who said that a treatment option did not work for their friend, so they have doubts. It may be the case for that particular person, but it shouldn't be applied broadly. This makes it quite difficult to have an open discussion about all options and convince them otherwise. Again, I'm not saying don't do your own research. However, it is important to put things into context and sometimes take that advice with a grain of salt. The next concept to discuss is nocebo. We are probably more familiar with the term placebo, which is where a treatment is given with the expectation of a good outcome. However, the treatment should not have had any real effect, but the suggestion and the act of treatment produces the desired effect. Nocebo works in the same mechanism, except the expectation is a negative outcome, such as side effects of the medication or that the surgery or injection will not help. In my opinion, physicians and probably all healthcare providers are very guilty of this. Many of my patients have told me that surgeons emphasize that conservative treatments will not work for them. Like anything, there are biases and motivations behind these type of statements. However, I appreciate the power of these words. It's one thing to believe in your treatment and that you are doing what's best for the patient. It's another thing when you are casting doubt on treatment options you don't offer that could very well help the patient in the future. Sometimes the dosing of the treatment is suboptimal and the patient perceives it as a failure. From a clinical standpoint, I see this particularly with medications. Another physician starts a medication at a lower dose, whereas my experience is that a higher dose would be more beneficial. However, the patient does not want to retry that particular class of medication because they've already concluded that their response is suboptimal and that it is going to lead to a failure no matter what. Another form of underdosing is stopping too soon. Again, we all like a cure-all where it is a one-time treatment with absolutely no side effects. The time to a therapeutic dose varies with each medication. Naturally, people want to feel better immediately. I had a patient stop the medication after day 1 even though the dosing is for 5 days and they concluded that it did nothing. Another reason for stopping too soon is known side effects. In order to get to this optimal dose, there can be some side effects that I will educate patients on what they may experience. But a lot of times people will stop taking the medications because the side effects were intolerable and then they conclude that the medication was a failure. From my standpoint, it was not a failure because they were not able to achieve the therapeutic dose. Personal interactions with the physician and staff definitely can affect the overall treatment outcome. I've had patients see an amazing physician who I know has a skill set to help them. However, they never went back for a follow-up because they had a negative interaction with the staff. Another example is where the physician is, let's say, not very friendly. They can sometimes sour patients on any other physician in that field or physicians in general. Lastly is technology. Technology is great, but not everybody likes it, and it doesn't always work the way we want. We have all been frustrated by an automated phone system when you just want to talk to a human. I've definitely had patients not want to see me because they prefer filling out paperwork by hand versus digitally, and vice versa. While this does not necessarily affect the treatment outcome, this can certainly contribute to an overall negative experience. Thank you for your attention and listening to this talk. We are all human. We all make mistakes. I'm hoping that this gave us some insight on how we all can get better.